Before we get into tonight's video, let me introduce you to Be Brave ASMR Spa. Have you ever wanted to experience ASMR in person? Well, now you can at Be Brave ASMR Spa. I have designed a range of ASMR experiences that you can have filmed or not. If you choose to have your ASMR experience filmed, you will get 10% off. 2 of the ASMR experiences that I'll be offering are a sensory scalp ASMR experience and a sensory back ASMR experience. Be Brave ASMR Spa is in Shrewsbury, Shropshire, and is based within a gorgeous salon called Glow Shrewsbury. If you would like to relax and awaken your senses, click the link in the description box below, which will take you to my website where you can book and even buy gift vouchers. I look forward to meeting you soon at Be Brave ASMR Spa. Hello, lovely. How are you? Good. I'm Dr. Nicola, and I'll be carrying out your skin assessment today. It's nice to meet you. I'm good, thank you. So, my love, I've had a little look through the referral that your doctor sent over, and I believe that you both are concerned about getting that mole there and the pigmentation on your face. Is that right? Okay. Now, can you just confirm your full name and date of birth, please? Thank you. Right, now if you could tell me in your own words what's been happening. Right. So have you always had that mole? Right. Okay. So you think it's changed shape, become a bit raised and got a little bit bigger. Okay, and when did you notice the changes? Okay. I don't suppose you have a picture of what it looked like before? Maybe in a past photo or something where we can maybe zoom in? Okay, we'll have a look in a little bit, alright, my love. Okay. Now, pigmentation. You do have quite a lot. Yeah, I mean, you've got obviously quite a lot of freckles. Have you always had freckles? Okay, so it's more of a newer thing. Okay. And what colour is your hair naturally? And would you say you're quite pale naturally, or? Okay, and do you burn easily? Okay, so you don't have typically skin that would burn easily, and so you're not typically prone to like freckles and things like that. Okay, yeah. Do you wear SPF? Okay, probably not as much as you should. Alright, at least you're honest. Okay, and are you in the sun a lot? Do you use fake tan? And what about sunbeds? You do use sunbeds. Okay. Do you pop on any accelerators or anything like that? Do you have done? Okay. On your face as well? Okay. Alright. So you do like a nice good glow. And when was the last time you used any fake tan or had a sunbed? Okay. Alright. Alright, my love. Now, when did you notice more? When did they start coming out more? Okay, so when you're getting older. Okay. Right, so you notice just through the summer last year, and then with you going away a few times to quite hot places, you've noticed more and more come. Okay, makes sense. Alright, okay, just jot some notes, okay? I say jot, you know, type. Colour your eyes. Okay. Alright. Okay. I take it you don't have any makeup on today. Good. I'm just going to have a look, alright, my love. Okay, so you do have quite a bit of pigmentation here. Yeah. Like little freckles, some of them are, but then others a bit more like little patches, which, you know, people can get those as we age. We call them age spots, you know, but a lot of it is pigmentation, sun damage, and things like that, okay? So it's just over time you accumulate, you know, little patches, you know, because obviously as we age, we tend to be in the sun a lot. As you see, I've got little patches here which I never used to have. Yeah, okay. And I can definitely see that you do have some distinct freckles, but then you do have more little patches as well, which are slightly different shades. And I can see that's the same for your nose. Alright. And by the looks of it, on your forehead as well. But what I have noticed on your forehead, you do have a couple of larger patches, okay? Now this is your typical pigmentation, so have you noticed the darker patch? Yeah, and you are concerned about that. That is actually quite common as we age, and if we've been in the sun a lot and things like that, okay? I will obviously feel and measure and do different things like that later, okay, so you don't have to worry. I will double check to make sure that everything is fine. Okay, just looking, it does look slightly raised, my love, so I know I definitely do want to, you know, monitor that and, you know, have a good assessment of it. Alright, just by looking as well, your skin does look quite dry, it's quite tight. Yeah, probably a little bit dehydrated in places as well. But, you know, if you have got sun damage, you know, your skin's probably going to be quite dry, quite tight. Yeah, and you can get little like wrinkles form. Alright, yeah. Okay. Okay. Can you just smile for me? Okay. Okay, relax. Can you raise your brows? Okay. And can you frown? Alright, relax. Thank you. Right. Okay. Okay, my love. I'm just going to get my light, okay? Have a look. Okay. This is a very bright light, so you might want to close your eyes. Okay. Alright, I am going to just pop this purple light over, okay? This will show me a bit deeper into your skin. As long as the battery doesn't run out on me. Okay, I can see a little bit on your chin. I can see more patches on your nose that aren't actually visible. Then around your mole you do have some pigmentation that you can't actually see, so it's quite deeper in. Okay. Same on your forehead, my love. Different patches dotted around, different sizes, some quite discoloration just at the top there. Close your eyes for me. A little bit on your eyelids as well. It's potentially where you may have fell asleep without any sunglasses on or something. Yeah. There's a chance that eventually these patches that I can see will actually come very noticeable. Okay. Does tend to happen. Okay. I'm just going to get my magnifying glass, okay? So your mole does look quite dry as well. Does it ever itch? Okay. Has it ever had any discharge, bleeding, or about scabbing? Okay. Some of the patches on your nose are a little bit raised. And same for your forehead. It'll be interesting when I feel. Okay. 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 Okay, lovely. I'm going to pop on some gloves, okay, and have a feel around your face. I am obviously focusing on your pigmentation and the mole, but I also want to assess your skin, okay, and to see what's going on. Alright, okay if I can touch. Okay. Start on your nose, okay? Yeah, I can feel a little bit of bumps. Okay. Yeah, it's very tight on the nose area, a little bit red as well. Like you've recently caught the sun. Yeah, it's definitely dry. When I'm squeezing, you can see that it's actually really dehydrated as well. Okay. Okay. Chin feels okay. A little bit tight on that. Do you use any skincare at all? What do you use? Okay. Has your skin always been dry? Okay, so you're typically on the drier side anyway. Okay, so you're looking normal to dry, are we? Yeah, it's possibly looking at your skin right now, I would say that you are a dry skin, but with the amount of sun damage, that's quite likely anyway. But if you've always been on the drier side, that's probably typically what your skin type is. But I think we have got a lot of dehydration on the go as well, which is crossing over, making it probably look even drier. Okay. I'm just feeling the pigmentation. Slight raise. Fill over the mole. Okay, so I feel a little bit on the rough side. Yes, definitely rough. And it is raised. Okay. I'm not going to squeeze hard, I'm just gently going to tease, okay? Any pain? Okay. Okay. Okay, I'll come back to that. Look in your eyes. Have a little bit of darkness, okay. We do have some lines under the eyes. And a little bit of crow's feet there. So we've got fine lines right there. Okay. You do have a lot of dehydration on your forehead, okay? When I'm squeezing, you can see a lot of dehydration lines. And just by looking now, you do have some noticeable fine lines, okay? But I think what's making it worse, how dry your skin is and how dehydrated your skin is, that mixing together is not a good combination. And because your skin has quite a leathery feel to it, it's really quite dry and tight. It feels tight when I touch. Day to day, do you feel that your skin is very tight on your face? Yeah, and do you notice a little bit of shine? Yeah, you don't have oily skin, my love, okay? The shine is because of how dry it is. So your skin is trying to overcompensate. Yeah. You don't have a lot of bounce in your skin, my love. No. It's very tight and it's not very supple. Alright. You noticing that? Yeah, you're probably not having a lot of joy with skincare and things like that because you're still using sunbeds and things like that. And even if you are wearing like an SPF, you're still in the sun a lot. Are you using SPF on your face? What factor? Okay, and what form are you using? Right, so I would recommend you using more of a lotion, because if you're using sprays and mists, it doesn't necessarily go in the place that you want it to go, so then it's floating everywhere and not necessarily going in all places on your face. Same with your body, really. Yeah, so you know, maybe if you are spraying a spray on, then rub it around your face a little bit, Okay, make sure you are keep topping it up. But the thing is, if you are using the sunbeds, that's just, you're not getting away from that. Okay, I would definitely recommend that you stop using the sunbeds, if I'm really honest with you, especially if you are concerned about, you know, pigmentation and more pigmentation coming. Like I said, I can see a lot of sun damage deep within, so you're just making it worse. You keep adding to it. All right. Okay. Your skin, you see, is very tight. Your elasticity is not very good. You've not got a lot of bounce. Yeah, it's really tight and crying out for some more moisture. Right, so if you've been popping on more products for combination skin or oily skin, you're not actually helping your skin, you're kind of making it worse. Now, when you might see that oily shine, that's not because your skin's oily, it's because your skin's overcompensating, okay, my lovely? Yeah, so keep away from that. We need to be using products for dry skin, okay? We need a good, deep, rich moisturizer, okay, my lovely? Yeah, you don't want to use anything too harsh on your skin. You don't want to be stripping the skin, okay? Just nice, rich products, okay? Things that are really going to give you a nice clean, but they're not going to rip your skin off, okay? And same with an exfoliator. You need to be using something light, but you do have a build-up of dead skin cells, my love. You can see them. I can see them with the light. Now you need to be exfoliating at least once a week, okay? Just gentle circular motions, okay, like so. With a nice, gentle exfoliator. Nothing too grainy, because your skin's so dry, it's going to pull on it, you're going to get friction, you're going to get red, you can cause bleeding and scabs and things like that, okay? So we need to watch what we are popping on our skin. Stop using any purifying products, my lovely, okay? Yeah, you're making your face drier, okay? What you will notice as well with sun damage and dry skin, potentially your appearance is going to age faster, okay? Because obviously you do have lines, but they look worse when your skin's dry and tight, and when it's dehydrated it looks worse, okay? Yeah. Okay. Do you ever have breakouts? Okay. Have you ever had acne or anything like that? Okay. You smile. Go frown. Raise your brows. Okay, relax. Close your eyes. Pick it up if you wish. Okay, I'm just going to apply this to mole. Bring it in my bright light. Bring it in my light. Okay. Take some measurements so I don't go my lumps. Gently squeeze. Right, okay. Let's put this on. I feel okay. Okay. I'm a little bit concerned by the mole. Okay. I think it is okay, but I'm not 100% sure because of the excessive use of sunbeds, being in the sun, not using correct SPF and all that, okay, and everything you've told me and how your skin appears. I think it's best that I do take a little sample and get it sent off to be assessed properly, okay. Yeah, I mean, your skin is very heavily sun damaged. You've got a lot of freckles, pigmentation patches, and then with the mole, you know, that you're concerned about that. And obviously, you know, your skin is very dry, very tight. Alright, so I do want to check that if that's okay. Would you mind just finding the picture for me so I can just have a little look? Thank you. Okay. And when was this? Okay, yeah. So it definitely is a change in that. Okay, thank you. If I can just take a picture of that. Okay. Perfect. Thank you. Right, now if I can take a picture of the mole. And overall. Okay, lovely. Right, let's take this sample. Okay. Alright, so I'm just going to take a little bit of skin from around the edge of the mole. You've just got some dry, flaky skin around it. I just wanted to take some of that. Okay. Right, so now I'm going to take a biopsy. So I need to just wipe the area. Lovely. And I'm going to just inject the area with some of this numbing agent, okay? Okay. Gently. Sharp scratch. Sharp scratch. And sharp scratch. And one last time. Sharp scratch. Is that okay? Good, let me just put that there. Lovely. Okay, I need to leave that for about 10 minutes, my love, and then I can take the biopsy. Alright, are you feeling okay? just going to have a little feel around. Does that feel okay? Ah, good. That's what I like to hear. So I'm going to take the biopsy. Okay. I'll pop that on afterwards. I know it's a little bit big, but I need the area to be protected. Okay, get nice and still. That should come up nicely now. Just gently peel that little bit off. Lovely. And pop that on there just to stop the bleeding. That's it. Nicely does it. Yeah, it's fine the way it is. Okay. How's that? Good? Perfect. Okay, so I'm going to take this off to the lab to get that assessed. Okay. Good. How are you feeling? Alright. Please leave that on. Okay. Don't wash your face until tomorrow. Okay, then you can take that off. Alright. There shouldn't be any problems with it at all. Okay, my lovely. It was nice, straightforward little cut. Tuck straight off. Not a problem. Alright, don't need any stitches or anything like that. Stop bleeding and it all looks good. Okay, you shouldn't get any infection or anything like that, no. Alright, so just leave that, and I will have to see you back in about a week to give you the results, go over everything and go from there. Alright, but if that does come back normal, that's fantastic. But I'd still want you to refrain from using sunbeds, okay? Please wear sunblock, sun lotion, SPF, anything like that on your face. Apply it regularly, even over makeup or under makeup, depends on which type you have. And try to use more of a lotion if you can. Alright, and please avoid sunbeds. Okay, it's crucial that you do, especially if you are concerned about things like this. Okay, and if it is more sinister, then you definitely need to give up the sunbeds. Okay, yeah, but as it stands, I think we need to work on your skin. I need you to drink plenty of water. Okay, keep yourself hydrated, and I want your skin to be kept hydrated as well. Okay, I could do with making you like a routine. I think that would be really beneficial to you, and you know, use products that are good for dry skin. All right, and anything hydrating as well. So, you know, some hyaluronic acid would be good. Now, retinol and that down the line, I think would be perfect for you, especially to help with any fine lines. But at the moment, your skin is a little bit too dry, bit sensitive because of the dryness. Do you know what I mean? So we need to calm all that down, and then you could probably add in like a retinol and things like that. I want you to be using good products, nothing too harsh. All right, I want you to use a soothing cleanser. All right, my love, use a toner that's quite gentle, maybe a rose mist or something like that. Okay, and I want you to exfoliate with a gentle exfoliator once a week. Okay, and make sure you are using a moisture mask or a hydrating mask. Okay, yeah, and you can pop on an eye cream as you would, but make sure it's a nice deep rich product to get really under those eye area. Okay, my lovely. And with your moisturizer, it needs to be a nice rich moisturizer that is perfect for dry skin. Okay, just have a look around and see what you feel. Probably look at more luxury brands, which will give you much more of a beneficial result. Okay, my lovely. Yeah, and then obviously we can go from there. All right, yeah, but make sure you're using SPF as well. Don't forget that is crucial. All right, and try to refrain from keep touching your face. If it is windy and things like that outside, try to cover your face up or pop on some more moisturizer. Okay, my lovely. I want to try and protect the barrier. All right, because obviously you've been rubbing away at it, the friction from the sun and all that. Okay, it's very dry, looks very sore in places. All right, yeah, it's all due to the sun damage, my lovely. Okay, you don't have eczema or psoriasis or anything like that. Okay, yeah, it's typical sun damage and your skin is extremely dry, dehydrated. All right, okay. But next time I see you, we can go through some skincare and different things like that, my lovely, and what I recommend for you. But at the moment, I'm just concerned about the mole, want to get that assessed and sort that out. And down the line, there is treatments that we could help with the sun damage and things like that, okay, to help reduce the visibility. All right, but at the moment, something like that's going to be too harsh for you. All right, you're welcome. So I'm going to get that off and I will get the nurse to take some blood from you today. Okay, so when you've come from me, take a seat in the waiting room. The nurse will come out, do some basic checks, take some blood, and then you can go. All right, and I will see you in a week's time. All right, it's the same day and same time, okay for you? Perfect. I look forward to seeing you then. You're very welcome. You take care now. Bye-bye.